Good morning, Congressman Burgess here. I'm here this morning with Bill Kristol, editor of the Weekly Standard, former communications director for Vice President Dan Quayle. Bill, of course, is a fixture on Fox News Sunday, and we all rush to the television every Sunday morning to hear what he has to say on the panel. But, Mr. Kristol, it is evident right now, here we are, the latter part of October of 2009, in the off year between elections, dealing with this health care conundrum and lots of talk back and forth. On our side, we hear criticism for not having a big Republican bill. We hear criticism for not perhaps having 5 or 6 smaller bills that would deal with the difficulties. Just what would be your best advice as far as a strategy going forward? Yes, we can and should oppose what the Democrats have out there, but is it better to do a single bill? Better to do several shots at this?
Well, first of all, we should defeat Obamacare. That would be a great contribution to the country, and that would be the right thing to do. And I know you've been working very hard on it, and with some success. If we propose a large bill, it's not going to pass. And it strikes me that we therefore should try to propose a bunch of small bills, or one small bill with a lot of discrete provisions, interstate purchase of insurance and the like, which I think some Democrats would have trouble not supporting, and which, if Obamacare collapses, one could then actually move as legislative items in 2010. So I prefer the small bill strategy on the whole.
And you look back at 93, 94, of course I was just a regular guy back then, but health savings accounts that we have today actually grew out of the ashes of the failed Clinton strategy because Bill Archer and several folks on both sides of the Capitol had some good ideas about what some Republican alternatives were, and as a consequence we have the type of insurance that I carry today and have had for several years, and really has worked very well. I don't know if it'll be allowed to continue under the healthcare commissar, but I can't help but believe that if this system collapses, there will be something good on the other side.
Yeah, I think we have a chance to pass some reasonable reforms in 2010, and then I think the bigger thinking Republican reform, the bigger picture Republican reform, that's really something for either 2011 or really for the presidential candidate in 2012.
Great. Thanks very much for being here with us this morning.